The current reproduction number in the National Capital Region is now at 1.15 from 0.91 last July 15 to 21. This means a person infected with COVID-19 can infect more than one individual. The spike in cases seen in some regions seem like to be the start of a COVID-19 surge during the first quarter of 2021.
We're seeing an increase in cases which is similar to the increase we saw last February. Maybe it's too early to call it a surge, pero we should not wait for it to become a surge before we act on it. So it's better if we are cautious, we act on this now and make preparations, make interventions.
If COVID-19 surge happens, hospitals will be overwhelmed again and additional manpower of healthcare workers will be needed. The research fellow projected the number of new cases in the country may reach up to 10,000 cases in the coming weeks. OCTA Research Group calls on the government to be proactive to prevent another COVID-19 surge to occur in the Philippines.
It was definitely a surge by February 26 or February 24 to 26. And then last time nag-ECQ tayo, March 28. This was 1 month after. So medyo delayed yung response natin before. We shouldn't wait that long this time. We can act quickly. It can still be curbed. It can still be mitigated.
Professor David of OCTA believes that one cause of surge in NCR is due to Delta variant.
And based on the evidence that there are local cases of the Delta variant in Manila, in the NCR, there is sufficient cause to suspect that at least part of this is driven by the Delta variant. And we know that the Delta variant is rapidly spreading.
According to Secretary Francisco Duque III, they cannot confirm it yet, but there is a possibility of local transmission of Delta in the country.
We cannot say that, but it's good to assume there is, okay? As we ramp up our response, our capacities, we need to assume na meron na local transmission. But there is yet no evidence to establish because investigations are ongoing to link these identified local cases to an international traveler who might have brought it in. And once you are able to establish that, then mas maganda because, of course, it doesn't mean that only just because ma-link mo siya to an international traveler, you let your guards down. You don't. That's why you continue to assume that there is transmission.
Meanwhile, today there are new cases of COVID-19 variant in the Philippines. There are additional 187 alpha variants, 142 beta variants, and 12 P.3 alert for further monitoring variant cases. There are also 12 local cases of Delta variant detected. There are now 47 Delta cases in the Philippines, 3 have died. World Health Organization warns that Delta variant may be dominant in 124 countries with Delta cases in 2 months' time. According to the DOH, the government is preparing for possible surge due to Delta. Aside from oxygen supply, hospital and facility beds are expanded. The DOH says intensified and strict border control in the country should not be eased, so Delta variant will not be dominant. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.